This afternoon, we shall maintain our format. The SGF will make his remarks. We'll take the technical inputs from the Minister of Health, the DG NCDC, the National Coordinator, before we take the questions. If there are other interventions from ministers, we shall bring them to the podium to present their updates. I now invite the Secretary to Government to please make his remarks. SGF, sir.
Members of the Presidential Task Force on COVID-19, let me also specially welcome the Honorable Minister of State, Labor and Employment, and the President of the Nigeria Labour Congress and his officials, distinguished ladies and gentlemen, gentlemen of the press. I welcome you all to the briefing for Friday, 24th April 2020. I begin this briefing for today by saying Ramadan Kareem to all our Muslim brothers and sisters nationwide. This is a season of supplication, and I pray that Almighty shall accept all our supplications, cleanse our land, and show mercy upon his people. Yesterday, the ECOWAS heads of state held a summit via video conferencing to chart a common course for the sub-region on COVID-19. The summit was concerned about the negative social, economic, financial, and human security impact of COVID-19 on all ECOWAS member states, as well as the serious threat posed to the regional integration process and regional peace and security agenda. I'm pleased to inform you that in consideration of the need to ensure high-level coordination of all the regional efforts to contain the pandemic, the summit appointed His Excellency Muhammad Buhari, President, Federal Republic of Nigeria, as champion to coordinate the COVID-19 response and eradication process in the ECOWAS sub-region. This is a monumental recognition for the leadership role of our President and an endorsement of the direction we are headed in our national response. The implication of this assignment is that the PTF must now factor the West African sub-region into its plans and activities to support Mr. President in his new role. I must add that the summit also set up ministerial coordination committees on health, finance, and transportation to coordinate regional efforts under the supervision of the champion. Today, the welfare of our frontline heroes, the health workers, came to the front burner. I'm pleased to inform you that the Federal Ministry of Health, working in conjunction with the MDAs and the health sector professional bodies, have signed an MOU for various allowances and other incentives. The full details will be unveiled to you by the Honorable Minister of Health very soon. I am, however, pleased to inform you that in addition to what the federal government is doing, the insurance industry has responded massively to the call for support. The Presidential Task Force has received a life insurance cover to all frontline workers on COVID-19 for a maximum of 5,000 health workers who are employed to fight against the COVID-19 pandemic. The premium in the sum of 112,500,000 for cover has been fully paid by the Nigerian insurance industry in line with the principle of no premium, no cover. The PTF wishes to thank the insurance industry immensely and calls on other sectors of the economy to rise up to support the efforts to fight COVID-19. I also call on our frontline health workers to double their efforts, just as we want to assure them of our determination to protect them. I informed you earlier in the week that the PTF has embarked on the assessment of the readiness of 9 states. These visits have been quite informative, and we have, as a consequence, strengthened our collaboration with states. The Presidential Task Force will be fine-tuning the directions and advisories in order to effectively guide the states and for uniformity of approach. I use this opportunity to once more commend the governments of all states visited for providing leadership and resources in their preparations. I also wish to use this opportunity to restate that food security and self-sufficiency remain important to our national life. I therefore urge all our farmers to begin to prepare for their return to their farms as the planting season is here. The Federal Ministry of Agriculture has put in place arrangements for access to farm inputs, extension, and other services. The Presidential Task Force continues to work assiduously towards presenting a report to Mr. President after considering all critical factors. Let me state that these are unusual times. We are in uncharted territories, and we need to forge ahead. As we work out our models, we also draw lessons from other jurisdictions that have had experiences to share. We shall, however, continue to pursue the strategy of aggressive testing, detection, isolation, contact tracing, treatment, and care. Finally, let me repeat my appeal to all Nigerians to continue to comply with all advisories. These are still the most efficient measures that can help us manage the ravaging virus. I now invite the Honorable Minister of Health to present his update and to most sincerely thank you for listening. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers here present, the Leader of Labour, Directors General, ladies and gentlemen of the press. Again, what I will say will reinforce much of what the Secretary to the Government has already put down. And as of today, 24th of April 2020, 981 people in 25 states of the Federation and the Federal Capital Territory have been confirmed to have COVID-19 infection. The 108 additional confirmations are as follows: 78 in Lagos, 14 in the Federal Capital Territory, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, and 1 each in Kwara and Plateau. 197 persons have been successfully treated for COVID-19 and discharged home, while 31 deaths have sadly been recorded. Again, the high number of new cases is due to ongoing community transmission and also the very active and accelerated case search going on. From our test statistics, most affected age group among the positives is the age group between 31 and 40 years, while the highest COVID-19 fatality rate is among the older generation above 50 years of age. We have now deployed COVID-19 starter packs to all tertiary health institutions and federal medical centers to complement what was earlier sent to each state. The starter packs consist of medical consumables and disposables to ensure that our frontline healthcare workers are protected, and also that there is synergy and collaboration between federal tertiary institutions and the host state health network. The COVID-19 capable National Laboratory Network, led by NCDC, has capacity to test over 1,500 samples per day in at least 13 laboratories, but the present utilization rate is barely 50%, since we averagely test about 600 samples per day, being the samples received at the centers. Efforts are on to increase the number of functional laboratories in the country. However, we need to meanwhile improve surveillance, sample collection strategy, and transport logistics to laboratories, and also reduce the turnaround time for tests. In our strategy, testing positive is followed by isolation and treatment as needed. Those who require no treatment still need to be in isolation in the interest of the public and their household. We urge all persons who have tested positive to comply, and for citizens to remember that anyone who has tested positive is not only just a private patient, but a patient of general interest. The COVID-19 virus has long since been declared a public health emergency of international concern. I wish to use this opportunity to applaud our frontline health workers again in the COVID-19 pandemic. Salute your courage and patriotism, but I urge you to protect yourselves as prescribed and use your personal protective equipment judiciously. Do not attempt to treat COVID-19 patients without using adequate PPE, or if your institution is not accredited to do so. This is important because we need to keep health workers safe at such a time and cannot afford the numbers who test positive to COVID-19 and have to go into isolation. Remain vigilant in the line of duty and maintain a high index of suspicion for this infection. I wish to appeal to all citizens to take the advisories that we give here daily and also repeat every time. Take these advisories seriously and adhere to the hand and respiratory hygiene as well as the social distancing directives. The use of a cloth mask or face covering when you leave your residence is recommended, as is the injunction to avoid mass gatherings and non-essential travels. I wish to restate the advisory given yesterday to reduce risk of community transmission by reducing all non-essential travel, especially long-distance travel. This will help to reduce the risk of carrying the virus from one state to the other. Today, want to join the rest of the world to commemorate World Immunization Day, World Immunization Week. The theme for this year is Vaccines Work for All, and is dedicated to promoting the use of vaccines to protect people of all ages against diseases and death. While waiting for the vaccine for COVID-19, let us collectively adhere to all public health advisories. Finally, I emphasize again that to defeat the spread of COVID-19 requires collective and individual efforts. If you suspect you have been exposed to COVID-19 or anyone around you has been, call the toll-free NCDC numbers and the emergency number of 112 and 0800-97000010. Resources and real-time information on COVID-19 can be found in the social media handles of Federal Ministry of Health and the NCDC, the Federal Ministry of Health website, and NCDC microsite. Please stay home, stay safe, take care of yourself, take care of your family, take precautions.
So, gentlemen and ladies of the press, Chair, distinguished members of the Presidential Task Force. Firstly, I'll join the Chair and the Honorable Minister by wishing all my Muslim brothers and sisters Ramadan Kareem. So, COVID-19 has changed the way we live our lives in many ways. But one thing it hasn't been able to do is knock out our spirit as Nigerians. So I'd like to start today by really thanking everyone for your continued sacrifice on this journey, and your continued cooperation with the lockdown as advised, instituted by Mr. President and many other governors across the country. As we traveled around the country over the last 4 days, we could really see how difficult it has been and how hard Nigerians have been trying to do their very best. We know it's a difficult journey, but we also know that we will eventually exit this stage and we start our normal lives. But that stage is still a while to come. And I ask for your endurance, your support, your patience. Lots of efforts are going on across the world to find new therapies, to find vaccines. Everybody is pushing very hard in this direction. So we need to stay firm and continue trying. We need really unprecedented levels of caution and to continue carrying out the preventive measures that we've advised severally on this platform. I'd like to really refocus and re-emphasize 5 of them, and really to ask everyone to support each other. When we talk about hand washing and respiratory etiquette, it sounds very difficult, and to be honest, it is difficult. Right now, I can't get back into my own household without being sent to wash my hands. And this is the reality. I don't rely on myself anymore to carry this out. Everybody knows in my household that they have to see me. So it's kind of supervising me to do the things I ask everyone to do, in recognition that none of us is strong enough to do this all the time. So I'd really ask everyone to find those checks and balances in our own lives, whether it's in our workplace or at home, to make sure that we do the things that we have to do. Physical distancing is very difficult, so we can't rely on ourselves either. So when you're on a queue and you're moving towards an entrance, hold back or ask other people to do the same. So you allow yourself some distance. This is not easy to do, but we all have to hold ourselves accountable for it. Face masks, as you can see, I had to take off mine to speak to you. I'll put it right back on after doing this. So we too have to hold each other accountable to doing this. It's come slowly, but now we have to accept that almost every time we leave our homes, we need to wear those masks. And it's not as if they're not important at home, but at home we're among a family, and any exposure within that family is difficult to control. So at least we keep whatever we have in the family, and when we go out, we prevent ourselves from spreading it. And spreading it, you do by when you go out. And, you know, we're an outgoing society. We live outdoors, we walk outdoors. So staying at home and thinking about every movement that we make is very important, especially when we feel the need to travel. And I recognize how difficult this is at the moment. Many families I know personally have not been able to bury their dead, have rescheduled their marriages, have rescheduled their baptisms, have rescheduled everything they're doing. So in a way, it feels like life is in suspense, or we have suspended so many of the things that we hold very dear. So I am sure that everyone on this side of the table recognizes the great sacrifice being made by Nigerians. But we only have to encourage each other to continue. Continue till we get to the position where we can relax some of that. But to get to that place, we have to continue in the short term. And finally, we must remember that the most vulnerable people to this disease right now are the elderly in our society and those with some comorbidities. What do we mean by comorbidities? Some other illnesses. We must protect them. And right now, protecting them is, if they're living in the village, please leave them there. Support them with whatever financial resources you can by sending them home. But please, now is not the time to encourage travel. Travel is difficult anyway, and rightly so. But really, if you have anyone that in your family, in your society, in your church, whatever social congregation you have, these are really the most vulnerable in our society right now to this new disease, and we must protect them as much as possible. So now, to conclude, we're all working hard to get to the point where we can relax some of these measures, but we're simply not there yet. So we ask you to join us, continue on this journey with us, amplify the messages that we are giving. There's no amount of risk communication that we can carry out through our different means that can get to every Nigerian. So we need every message sent out to be amplified several times more. We're very happy to have the leadership of the Nigeria Labour Congress here with us today. We really need your support in sharing these messages, encouraging our citizens to stay firm and join us on this journey. We will get to the end of it, but in the short term, we're asking you for some additional sacrifice as we continue to work hard to flatten the curve and see that we ultimately get out of this pandemic altogether. So thank you very much.
The Secretary to the Government of the Federation, honorable ministers, members of the Presidential Task Force, our esteemed visitors, ladies and gentlemen of the press, good afternoon. I would like to first of all start by saying that the PTF would like to assure the public that we continue to closely monitor the situation in Lagos, Abuja, and Kano, given the increasing number of cases that are coming up. We are working with all the state structures, including the state task force teams and the state emergency operation centers, to ensure we control the pandemic sooner rather than later. In terms of grassroots sensitization, which continues to be extremely important for the control of this pandemic, we'd like to reiterate the need for all state structures involved in the COVID-19 response to continue to engage directly with grassroots, particularly at the local government level, to ensure every member of society understands the pandemic we are facing. I would like to thank the National Orientation Agency and the various donor organizations that have been supporting community sensitization at the community levels. The government is also aggressively driving grassroots awareness through established state and local government sensitization committees and community mobilization structures like health educators, traditional leaders, and faith-based groups. We thank all these for assisting with the response. We will continue to expand our outreach, working with the state governments to ensure every Nigerian has access to life-saving information on COVID-19. Sticking to the theme of Ramadan, we'd like to re-echo the need to abide by all protocols, especially avoiding gatherings, wearing of improvised face masks, and hand washing during Ramadan. The task force has launched Ramadan messaging on radio, social media, and television to ensure our Muslim brothers and sisters are aware of the safety protocols. I would like to specifically thank the Nigeria Supreme Council of Islamic Affairs for their support and clear guidance to the Muslim community. As much as we encourage people to stay at home, it is also important that we all stay socially connected in one way or another through the various platforms, online platforms if we can, and through telephones, etc., and support each other during these trying times. Thank you.
Thank you very much. We will take the Honorable Minister of Information and Culture before we take the questions. Honorable Minister of Information and Culture, please.
Mr. Chairman, honorable members of the task force, the chairman of the president of the Nigerian Labour Congress and the executive, ladies and gentlemen, I just want to make a clarification. Yesterday, a gentleman asked a question here, and if I remember, he asked about a petrol attendant that was killed last week in Abia State. My response yesterday was to the incident that happened on the 17th of April in Abia State, which was last week. Prior to that time, there was another incident which happened on the 5th of April, where also a petrol attendant was killed. But that was not the question I was asked yesterday. That was not the question I addressed. I found later in the evening a statement by Nupeng, and I think it's important for me to make the clarification. The issue I addressed yesterday was the issue of the 17th of April. I had the opportunity this morning also to confer with the IGP, who also confirmed that yes, something happened on the 5th of April, but the culprit has been arrested and is facing the internal disciplinary measure before he will be prosecuted. So I just want to make a clarification. I was addressing the incident that happened on the 17th of April, and the question that was asked was actually about last week, not what happened on the 5th of April. Thank you very much.
Thank you, Honorable Minister. We shall now take the questions. Please be reminded that we have set a time for ourselves. We have also agreed that we'll make the questions direct and we avoid double-barreled questions. Thank you.
Good afternoon, sirs. My name is Juliana Taiwo Baloyen. I write for Sun newspaper. Minister of Health, Minister of State Labor, and probably the NLC president, since he's here. I got this from one of the resident doctors in Jos. He said 25 of them were recently sacked. 25 of them was recently sacked. And he's wondering why, in the midst of this pandemic, professionals that are more needed are being sacked. If you are not aware, now you are aware, are you going to act? The Minister of Health, someone wants to know if the policy of handing over the remains of COVID-19 victims to health authority still stands, or can family and friends now attend a COVID-19 victim burial publicly? SGF, sir, this is from another concerned citizen. She says she's complaining of harassment from AEDC officials threatening to disconnect her office electricity. She's She said they've been at home, they've been up to date with their bills, but somehow the NCDC is threatening, AEDC, sorry, is threatening to cut off their electricity supply. So want you to intervene and talk to them. I'm only a messenger, sir. That's basically it, sir. Thank you.
The Chairman, National Coordinator, Honorable Ministers, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually goes to the DG of the NCDC as well as the National Chairman. Yesterday, you confirmed that the lab in Kano is shut for the contamination and disinfection. I want to know how long will the decontamination and disinfection take? And are samples being taken from Kano to other states while this decontamination and disinfection is going on? Because I know in the last few days we haven't seen any confirmed cases in Kano, so I'd like to get an update on that. And the next question really is to the National Chairman of the PTF. Well, you have spoken several times about a synergy all across the country to defeat COVID-19. But yesterday, the Governors Forum had a meeting, and one of their communique is the fact that they want a decentralized coordination to contain the virus. I want to know what this means really, because they are insisting their commissioners of health have to be in charge of their state-owned response. I want to know how this synergy will work with the national as we try to contain this virus. And the next question, adding to that, they said that they're not being carried along. That's the state task force. They said they're not being carried along. So I want to know the steps you have put in place really to carry the state along as we fight to contain COVID-19. And finally, the Minister of Health. Well, the SGF earlier on told us about an MOU that was signed for the frontline workers as it concerns their insurance. He says you were going to expatiate. I don't know why you skipped that in your opening address, so would like to get more details concerning that MOU that was signed. And finally, to the State Minister of Education, really. You have spoken about the online classes starting. I want to know, when are we looking at these classes starting, and from what level? Is it going to cover the nursery, primary, secondary, and tertiary, or who are you targeting with the online classes that you have said that you're working on with the ministers, that's the state commissioners for health across the nation? Thank you.
Good afternoon, everybody. Rachel Abuja from the News Agency of Nigeria. My first question is to the representative WHO. Today is World Malaria Day. Madam, I would like to know what WHO will further do to help malaria, sir. What WHO will further do to help the Nigerian government to end malaria in our community. This to the NCDC DG. Sir, you just mentioned something about our older population, which is commendable. Since we have different strategies for testing and what we have, I would like to know what the PTF team will be putting in place in order for us to protect this group of persons to fight this pandemic. Thank you very much.
Good afternoon, all. My name is Helen Osamede Akins. I report for TVC News. My first question goes to the DG NCDC. Sir, there's a report that the detail of a girl who tested positive in Plateau has been everywhere, including her test results. Is it still ethical to violate the privacy creed of the medical practice? How do we differentiate between malaria symptoms and COVID-19 symptoms, considering the fact that we are gradually going into the rainy season, which gradually makes some people experience or develop symptoms that relate to that of COVID-19? My other question is this. On a daily basis, we record increments in the number of confirmed cases. Is there any projected time that we will get to start reducing the case? And lastly, thank God we have the NLC president here. With the lockdown and the livelihood, is it possible for us to have the PENCOM give at least 15% out of pension savings contribution with pension fund administrator to help Nigerians caution the impact of the lockdown in this period?
The Chairman, sir, members of the PTF, my name is Nancy Oyedia Orom from AIT. So my first question goes to the Director General of NCDC. So there was a case in Mabushi. We had that report yesterday on AIT that a community, about 500 persons were tested for COVID-19 and 40 persons came out positive. And some of the numbers these people gave and the addresses, they called people, some of them didn't pick up. And those that picked their phone number said they would not come for isolation because they haven't received palliatives from the federal government. So my question now is, so are there strategies on how to trace people aside just the manual? Because I've seen some countries that have come up with technologies on how to trace patients. My second question is to the Minister of Foreign Affairs. So there was a report from Punch yesterday that said about 72 Nigerians in China tested positive for COVID-19, and about 111 other Africans from the African continent also tested positive. And also a viral video where a Chinese national was asking another Nigerian based in China if it was true. But this guy, Blessing, I think his name is Blessing, debunked that fact. So I want to know the true state of that. Finally, sir, Mr. Chairman, please, I want to know the true state of the 500 billion naira intervention fund that was set up by President Muhammadu Buhari. Yesterday, the Chinese government donated about 48 million naira to the PTF. I don't know if that money is also going to that intervention fund. Thank you, sir.
Good afternoon, Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Nazif. I work for Voice of Nigeria. A lot of effort have been made since the beginning of the fight against this pandemic. Not quite long, Dr. Aliyu made mention of the need for the state structures to liaise with the local government in order to have a robust effort in fighting this thing. So many centers, testing centers and isolation centers has been established at the state level headquarters. What about the local government areas? We have 774 local government, but we have not had isolation centers at the local government level and testing centers. If we have, maybe this thing should tell us, please. Thank you.
Good afternoon, sir, and my colleagues. My name is Abiodun Oloyipopola. I'm going to ask in English. I only one question, and I'm asking in English. And I always honorably ask as Minister of Health, State Minister of Health, Olorunbe Mamora, to please, sir, answer in Yoruba. We really appreciate. My question is a follow-up question about the Chinese experts. The Minister of State told us that they have been tested, and we have not heard anything about it since there before yesterday. We want to know, have they tested them again, and what is the outcome? Ìtumọ̀ ìbéèrè tí mo béèrè ní èdè Gẹ̀ẹ́sì ni wípé àwọn ará orílẹ̀-èdè China tí wọ́n ní akọ́ṣẹ́mọṣẹ́ tí a gbà lálejò lórílẹ̀-èdè Nàìjíríà, mínísítà fún ètò ìlera sọ fún wa wípé wọ́n fẹ́ ṣe ìdánwò míì fún wọn, fẹ́ yẹ̀ wọ́n wò lẹ́ẹ̀kan sí. A fẹ́ mọ̀ ṣé wọ́n ti yẹ̀ wọ́n wò àti pé kí ni àbájáde àwọn ọmọ orílẹ̀-èdè Nàìjíríà fẹ́ mọ̀. Thank you very much, sir.
Good afternoon, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like the NCDC boss to actually respond to my question. Since the beginning of this week, we've been repeatedly told that the laboratories we have are underutilized. A lot of persons are not coming out for testing. Now, my question is, why are we not introducing door-to-door collection of samples? Since we cannot do door-to-door testing, Why are we not introducing door-to-door collection of samples, especially in those states that are burdened with this disease, so that we can scale up our testing? And there is a follow-up to yesterday's question that our Minister of Foreign Affairs responded to. Obviously, the person was listening to the program from UK, and he sent in a question. He said 2 letters were sent to them, those Nigerians who actually wanted to be evacuated. And 1 letter was sent on the 6th of April, which requested them to submit their data. And another one was sent on the 18th of April, informing them of their obligations. Part of the obligation is that they will pay their transport, and they also told them that they will have to submit themselves for testing when they arrive in Nigeria. They will be quarantined. Now, my question is this. Why are we not testing them in the UK? Why are we combining both those who may be having the virus and those who are free in this flight? We'll bring them here before we test them. And similarly, a similar distress call from China. They have been in quarantine for 3 weeks. They've exhausted their money because they are paying for their accommodation, their quarantine. And the Chinese government is saying that the delay is from the Nigerian government. What are we doing regarding them? Thank you.
Good afternoon, everyone. My name is Mitaire Ikben with the Nigerian Television Authority. Yesterday, the Minister of Health told us that more than 40 health workers have tested positive to coronavirus in the last 2 weeks. For me, this statistics is huge for frontliners with medical training, not to mention other frontliners without medical training like journalists, cleaners, and security personnel. So what is the plan of the government to mitigate the risk, the hazards, and the dangers posed to all frontliners in the COVID-19 fight? And we were just told now that 5,000 workers have full insurance cover. Are journalists involved in this? I want to also ask that we've not had patients. In the last few days, we've not had patients who have been discharged for coronavirus. Does it mean that the patients we have now are not responding to treatment? And a Nigerian just sent this now for the DG of the NCDC, that with 1.5% chance of coronavirus spread if everyone wears a mask, a face mask. Does this suggest that if everyone wears a face mask, the lockdown will be lifted? Thank you.
Thank you. We have taken all the questions. They have been directed in the following order to the Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State Health, and WHO. That is in one group. Another group to the Minister of Foreign Affairs, Honorable Minister of State Education, Honorable Minister of State Labor and Employment, to be supported by the NLC President, and finally, the Secretary to Government of the Federation. We shall begin with the Minister of Health.
Good afternoon again. Some of the questions that came up, I will leave for the Honourable Minister of State and also the NCDC. With regard to the doctors who were dismissed, well, I would say that this is not a time for any doctors to be pulled out of service. We need all at this time. We need nurses, we need laboratory scientists, we need all hands on deck at this time. But the people who were laid off, I think there must have been reasons, administrative reasons, which I do not know about. But again, if the reasons are strong enough, then it's not, they're probably looked into by the board of the hospital. hospital, and we shall be advised accordingly. Now, as for the burial of COVID-19 victims, I'll ask the NCDC to give the details of that one, and also about the decontamination. Now, for the health insurance, the Secretary of Government did say that the Minister of Health will say something about it, but not now, because there are still a few I's to be dotted and T's to be crossed. So the time frame for that will not be today, because the details will come out. But it is definitely something in question. It has gone very far. Just a few more details that need to be put in. And those who tested in Mabushi, 40, I think I'll leave that to NCDC to answer. But the question of isolation, any place where you have an isolation center, we have to have a complement of health workers who are monitoring the persons. Some of them have symptoms, and we can call them patients. Others who have those symptoms are in fact probably not even call them patients, they are just on observation. But they need to be monitored, they need to be looked after. So the strategy right now is to have functional isolation centers in every state. If the need arises, there are backups. We have multiple locations. We also have, in far advanced stage, a policy for setting up ambulance service to transport COVID-positive patients. So if somebody tested somewhere, they can be brought by an ambulance. So you can have one center where everybody will be looked after in the same way. And all states will get ambulances. And the training needed for both the drivers and the stretcher bearers there. It is better to concentrate things in certain areas. Some states might like to use other senatorial districts, but it depends on how many centers that are needed. In Lagos, for example, there are various treatment centers, not looking at local government, but looking at availability of the infrastructure and the hospitals that are adequate for that. In some cases, some hotels are being used too. So it depends on the need, actually. The question of door-to-door sampling, well, the NCDC will answer that. And also the questions of discharge. Yes, there are persons who are due for discharge. Before someone is discharged, he must test negative 2 times. The first time you do a test, they are negative, and then you wait about 48 hours, do another test. When the result comes out, they are negative again, then they can go. So because of that, you don't have people just coming out, being discharged anyway. You observe that they are discharged generally in batches. So a group of people test negative 2 times will be discharged. So the process is on. People are getting well, people are getting better, and there is no need to conclude that it's not happening. I think that's all, and I will invite the Director of NCDC to answer the other questions on Minister of State.
So thank you, Honorable Minister. I think the question on the Kano lab, yes, the Kano lab, we suspended testing for a couple of days. It's a routine measure. They'll be back on today or by tomorrow, actually. So that's not a major problem. In terms of the elderly population, I think we're not a bad place in Nigeria that we don't have too many care homes and collection of elderly people in specific locations. So we're actually in a privileged position. So I think asking what government can do specifically is a fairly difficult situation. I made that comment to encourage all of us to work together to see that we protect this population and prioritize them in the work that we're doing.
test results in Plateau, we never make our test results public for individuals. So if those things are public, they've been made public by someone else. So we never make our results public. Unfortunately, sometimes these things get out through different means, but we will not confirm, we will not deny, we never discuss individual results of anyone. In terms of malaria and COVID, malaria is endemic in Nigeria, and I think the emergence of COVID only reemphasizes the need for us to focus on malaria diagnostics. We actually have a very effective malaria test, a rapid diagnostic kit. The challenge is that many of us don't like using it and assume that we know what malaria is by teaching, by touching, by looking at people. But the truth is that there are many other causes of fever in our environment, so we have to really start rethinking about how we prioritize diagnostics in our health system altogether. The question on the projected peak of cases, unfortunately, we're not able to have a specific projection at the moment because it depends critically on the work that we do now, both on our side and on your side. So everybody should keep working hard on everything we've been speaking about to get the peak flattened as much as possible. The question on Mabushi, again, we don't, FCT is leading on the community testing, and they have decided specific communities that are at specific risk and are dealing with that the best way they can. Our challenge at the moment is not really in identifying contacts. So I don't think the use of technology for that is our biggest challenge. Our challenge is really for people to accept the importance of what we're doing. We're not the police or detectives trying to find criminals. We need people to cooperate with us, understand that we're working on a health challenge that everybody needs to be involved in. In terms of isolation centers at the local government level, I think we're still not quite there yet. Some states have set up these centers at the sub-national level. We just visited Ogun State, I think, have centers at the sub-national. Asaba, Delta State has centers at the sub-national level, not in every local government, but in senatorial zones. So that's, when you don't have infrastructure over the years sufficient for a problem, you can't start suddenly by having everything. You start building from somewhere, and that's really what we're doing, and the states have been very proactive in doing this. Now, the question of why we're not doing door-to-door collection, it's not really our strategy to go door-to-door to 200 million Nigerians to collect samples. We have a strategy of looking for people that meet the case definition, and even in communities where we're testing, we're not testing everybody. We're still asking, do you meet that case definition? If yes, we collect samples. On the question on discharges, this is data that is coming in from many centers around the country, so sometimes it's, it takes a while to get data in. From the labs, it's a bit easier to get that data in, so we'll keep updating the numbers on discharges as soon as we get them. There's a question on masks and lockdown. So whatever happens, the mask can only be used in conjunction with everything else. So the mask is not a silver bullet, and this is something we've been emphasizing as much as possible. So the masks are an additional measure to everything else we've been doing, and we have to continue doing those things together. So yes, we have all started using masks whenever we're outside, but please don't stop washing your hands. Don't stop your physical distancing. Do all of them together. It's only by doing it together that we'll get the effect that we want. So thank you very much.
So you answered the question, if samples have been collected in camp or suspended that.
Okay, yes, of course we had to suspend it for a couple of days. All those samples were sent to Abuja, which is why there's a bit of a delay, but by today they're being tested and we should have the results out of Kano.
Thank you. I think most of the questions have been answered, so I'll highlight a few things. So state task forces are not being carried along. Well, the Presidential Task Force continues to work with all state authorities, not only the task forces, but also the state commissioners of health and the state emergency operating centers. And we do have forums where issues are discussed. From the point of view of the detail of the patient that has gone viral, just to re-emphasize that health information continues to be personal. Confidentiality is not being put aside because of COVID. It is important that we continue to treat all our patients with dignity and respect. People have a right to their results. People have a right to know what is wrong with them. When it comes to public health, the right authorities will take action if there's a need for isolation. But really, when it comes to results, it's a personal thing that should remain with that person. What is the plan for mitigating the risk of COVID in persons working as healthcare workers? So here we're really talking about three things. One, training in infection control and prevention, because you need to know how to protect yourself. It's not just about the provision of PPE, which is the second bit, making sure that PPE is available across all the health facilities in the country, and also making sure that the PPEs are used rationally and they're used properly, because you can wear PPE and still contaminate yourself if you're not trained to use them properly. And then finally is the issue of education, being aware of the risks as a healthcare worker and making sure that you protect yourself, knowing the high-risk situations that you might find yourself, especially with regards to people presenting with unusual symptoms of COVID. Thank you.
Dr. Fiona Braka, WHO.
The Chair of the PTF and honorable members of the Presidential Task Force, thank you for bringing up the issue of malaria. As we think about COVID, we also need to bear in mind there are other high-burden diseases that we should not lose sight of. On 25th of April, we will commemorate World Malaria Day to draw attention to the devastating impact of this disease on families, communities, and societies. As the world grapples with COVID-19, this is an opportunity to highlight the importance of maintaining robust health systems and continuing delivery of essential health services in times of crisis. The theme for World Malaria Day 2020 is Zero Malaria Starts With Me. It's a grassroots campaign first launched in Senegal in 2014, and it aims to encourage everyone from policymakers to the private sector to communities affected by malaria. African countries have led a massive effort to control the disease, and last year Algeria was the first country to be certified malaria-free in Africa. However, every year 400,000 people die of malaria, and 94% of these deaths occur in the African region. Children under 5 years are the most vulnerable group, accounting for 67% of deaths. We have, through the Sustainable Development Goals, a commitment by countries to eliminate or end malaria by 2030. And WHO's high burden to high impact approach is one of the efforts that WHO is supporting countries to implement to address this burden. Specifically in Nigeria, WHO is collaborating with the National Malaria Program to review the situation, engage states on modalities for program continuation, and support states to identify innovative ways of delivering community-level services, especially long-lasting insecticide-treated nets and seasonal malaria chemoprophylaxis. The facility-based services for malaria diagnosis and treatment are ongoing at primary health care level, but they are challenged by low health-seeking behavior and fear of stigma. It's our hope that with the required financing, strong coordination, dedicated partners, and engaged communities, we can achieve a malaria-free Nigeria and malaria-free Africa. Thank you.
The Honorable Minister of State Health will wrap up the technical responses.
Thank you very much, Mr. Chairman, my colleagues in the PTF, the National Coordinator, distinguished ladies and gentlemen. Well, I'm going to respond to the question from the lady in Voice of Nigeria. Ìbéèrè tí arábìnrin wa láti Voice of Nigeria tí ó béèrè ní wípé kí ni àbájáde àyẹ̀wò tí a ṣe fún àwọn akọ́ṣẹ́mọṣẹ́ láti orílẹ̀-èdè China. Ìbéèrè yẹn gan wáyé ní àárọ̀ ìka tó wá síbí báyìí, ṣùgbọ́n èsì tí a gbọ́ ní pé fún ìdí kan àbí míì àbájáde yẹn àìtí ní lọ́wọ́ báyìí, ṣùgbọ́n mo fẹ́ fi dá yín lójú wípé ní kété tí a bá ti gba èsì àyẹ̀wò yẹn ó di dandan ká fi tó gbogbo orílẹ̀-èdè wa ní Nàìjíríà, àwọn ọmọ orílẹ̀-èdè wa láti jẹ́ kó mọ àbájáde, nítorí pé a ti sọ wípé a fún yín ní èsì àyẹ̀wò yẹn. So màá rọ̀ gbogbo wa wípé kí a farabalẹ̀, ó jẹ́ nǹkan tó ṣe dandan fún àwa náà láti mọ àbájáde, nítorí kí a lè rí pé a fi àwọn ọmọ orílẹ̀-èdè wa sí inú hílàhílò nípa àwọn tí wọ́n wá ṣiṣẹ́ fún wa. Bó ṣe rí nìyẹn, ẹ ṣé o.
Thank you. We will now take the Honorable Minister of Foreign Affairs, followed by the Honorable Minister of State Education and the Honorable Minister of State Labor and Employment.
Thank you very much. Good evening, everybody. The first question was in respect of a report in the Punch. You mentioned that there were 72 Nigerians apparently who had tested positive in China. Now, our consulate, we have a consulate in Guangzhou, which is the epicenter of this whole, all the things that are happening in China regarding Nigerians and COVID-19. And the figure that was given, the official figure that was given, was 9 for Nigerians. And as I understand it from our consulate, they added that a number of Nigerians were asymptomatic, but the figures that we had were 9. When I met with the Chinese ambassador, and he talked about a plane that had come in to the country in which there were Nigerian passengers that subsequently tested positive. It was also within that range, 9, 12, 13. So where the figure 72 came from, I really have no idea whatsoever. The second question was about, Nigerians in the UK and the whole issue of testing before boarding to come home or testing when they get home. Now, this is something that the task force studied very carefully and got all the best medical advice. And, it was finally decided that since there were some countries where it was not going to even be possible to get any testing done, that it was better, and maybe the DG, NCDC, or the national coordinator can further elaborate, that it was probably enough, that it is enough, in fact, that at the airport you just do the superficial testing, temperatures, and the general look if somebody is coughing or not coughing. And for reasons such as that, even if somebody at that stage, tested negative, it could be an incubation period, and they could actually be positive, and so on. So that it was better for all the normal precautions to be taken on the flight, and then to be tested when they reached the country. Then I've been getting a lot of messages, actually, also. China. Another question on China was that the number of Nigerians who were there and whose quarantine period has been extended, and they're finding it difficult to pay because they're being asked to pay for their hotels. Now, when I engaged the Chinese ambassador, one of the things that the Chinese government, he assured me, were going to address and had started to address was the issue of the costs, the payments that our Nigerian brothers had to pay, and that the government was going to also look favorably at extending some assistance to Nigerians. And so that's one issue. But of course, to then say from there that their predicament is because of the delay on the part of the Nigerian government in evacuating them, is not totally correct, because you can only evacuate when everything is ready here in the country. And we have Nigerians who want to come back from all over the world. The numbers in UK alone is about 2,000, and the simple fact of the matter is that we just don't have the isolation centers and the hospital beds and so forth, and hotels to accommodate them all. We've been looking for hotels in Abuja and in Lagos. I spoke this afternoon with the governor of Lagos State, and it's a real challenge, even for the government of Lagos State, to find hotels that are willing to, to take these people in for the 14 days. A lot of hotels clearly, feel that it would damage their brand, it would have some effect on their business. And so that's being a real problem for us now. And then the other alternative is for people to then come back and be isolated in their homes. But when you have such numbers, some of the people of the task force feel that there's a risk that you will not have the guarantee that they will stay in their homes and be, under quarantine. And it will be very difficult to monitor that number of people, for 2 weeks. So this is a real dilemma that we're facing. And of course, you can imagine if they start coming back and then the numbers of positives and so forth start spiking, then the government will be now, blamed and said, but why did you, bring so many people back? So these are all the issues we're grappling, but hopefully we will find a solution to that. Now, in this context, the chairman of the Diaspora Commission, Abike Dabiri, has tweeted on her tweet that, that all the messages she's been receiving have been sent to the Honorable Minister, who has the final say, and another one that all directives as to COVID-19 come from the Honorable Minister of Foreign Affairs. Well, I'm certainly not that powerful. Mr. President has established a task force chaired by the Secretary to the Government, and all decisions on COVID are taken by this task force, certainly not by me, and as an individual, and to tell all those outside the country, to engage with our embassies, and we will communicate to our embassies and high commissions the decisions of the task force, not the decision of the Minister of Foreign Affairs. And I've been deluged with all kinds of messages. My numbers have been given out, and just to say that it's not a decision, a final decision that I will take. But we are doing everything possible to make it possible as quickly as possible to start bringing back home a number of our people out there. And we know the difficulties, the strains, and what they're going through, the financial challenges that a lot of them are facing. And we're looking at all the possibilities to really ease the burden on them and to facilitate their coming home. Thank you.
Honorable Minister of State Education.
Thank you very much, and good evening, everyone. I'll start from yesterday's question because, sorry, I was excused to go engage function. Yesterday, somebody asked if we could intervene in private schools who charge money from their pupils or students. I am not sure we can do that because all contractual arrangements made with private schools are as between the contracting parties. If schools reopen and want to run online and they have lowered or excused you from school fees for a period, or have granted discounts, or have asked for a particular kind of fee for that, that is within the domain of the contracting parties. What the Federal Ministry of Education does is implement the laws as they regulate the licensing, conduct, and delivery of what we approve as our syllabus and curriculum in respect of learning and learning outcomes. That's what we do. Then I'll go to today's question. The main of your question is, how are these online classes being conducted, and in what relation to what I've asked that the SUBEBs do? Okay, I will explain to you. Online classes are the same thing as offline classes. You can download them and keep and learn them at your pace. Online can be real time if you're on the same wave at the time when it is being taught. There are many tools. But what the Ministry of Education has done is to synchronize the platform such that at the Ministry of Education website, you will then look at what is available in the different states. And we've asked that UBEC and the SUBEBs at the states coordinate to access this. We've also gone further. Yesterday, we released that in furtherance of our earlier brief on COVID-19, the federal government, through the Federal Ministry of Education, collaborating with the telecommunications sector and providers therein, have granted free access to all Nigerian students to the following e-learning portals: the schoolgate.ng and the mobileclassroom.com.ng apps. These e-learning platforms have been declared subscription-free for Nigerian students in primary and secondary levels during the period of this lockdown as initiated by the COVID-19 pandemic. It will be recalled that due to the pandemic, the Federal Ministry of Education announced the nationwide closure of all educational institutions as part of measures to curtail its spread in the country. Hence, the need to explore other avenues to deliver lessons to students. it was also disclosed by the Honorable Minister of Education, Malam Adamu Adamu, that Airtel Nigeria network users can already browse these e-learning platforms for free, while other telecom service providers like MTN, Glo Mobile, and Nine Mobile are currently making technical adjustments to their systems to accommodate the free access. This is a provision we've already made, and this is in relation to how you can access the platforms. The second arm of your question will relate to what the states are now doing in relation to assessing them. Is this bulk of papers I hold here. Every state has how they've programmed the lessons to be delivered. And I'll give you a typical example. This is Anambra State, for instance. For senior secondary schools, Mondays, they start with economics at 9 a.m. stroke 12 noon to 12 noon. And you can access that on ABS, that is Anambra Broadcasting Service, on 88.5 FM. This timetable is for every state. All the states have timetables like this for all the subjects: economics, physics, mathematics, biology, chemistry, English language, literature in English, and subsequently for each class. This type of timetable is already available for every state that is already has accessed this, and it is available on the platform I told you, so that you can look at the one that is relevant for your state on the Ministry of Education website, because I can't just read through all the timetable right here now. But this is how it is. You can look at Lagos State, you can look at every state that has a Ebonyi State, all of them that are online, and the radio stations and on what frequencies they are broadcasting them, whether they're on TV and at what time, for which class and for which subject. All of that relativity has already been meshed into what we have provided on the platform. So if there is anyone that you would like to access and you're confused about the timetable, you can get on our website, the ministry's website, access the state that you're looking for, and then you can discountenance that along your timelines. Thank you very much.
Honorable Minister of State, Labour and Employment.
The chairman of the PTF, colleagues in council, members of the press. I think the question that was directed at my ministry has been partially answered by the Minister of Health. And that has to do with the health workers that were relieved of their appointments, I think, in Plateau State. We don't have the details too, but our duty in the Ministry of Labour is to act as conciliators in such a circumstance. And so for now, because we are very much aware of the impediments, if any such thing occurs now, with respect to health workers who suffer any kind of injustice from their employers, the impediments are that the courts are not open, especially the NIC is not functional. They can't rush to court and get relief. Even the ministries are closed for now. Perhaps they can try to get in touch with us through the ministry's emails, or even my personal social media handles. They send me a DM. I mean, these are unusual times, so we can adopt unusual methods now. They get across that we can make provisions to act as conciliators at this time. We understand the primacy of the work of health workers now, so we can make exception only for health workers to come out of our confinements and act as conciliators in such, quick conciliators in such cases. Thank you.
Thank you very much. We will take a two-phased intervention from the Nigeria Labour Congress. The President, Comrade Ibawaba, is here. He has distributed a number of face masks branded by the Nigeria Labour Congress. I'll invite him to the podium to say a few words and to raise the flag of the masks to all Nigerians.
The Secretary to the Government of the Federation, who is also the chairperson of the PTF, honorable ministers here present, gentlemen and ladies of the press. First, let me start by saluting the very wonderful work of this committee, the COVID-19 Presidential Committee, that have been working round the clock, 24/7, to try to contain this pandemic. It's not an easy job, and clearly speaking, I think I want to also appreciate the fact that many of our states have keyed in. Mr. Chairman, let me also use this auspicious occasion to thank you immensely for the interface you have allowed to be happening between the committee, particularly at the highest level through your office, and the Nigerian Labour Congress, and by extension, organized labor. I think these are critical times, and I do agree that collective effort and individual effort is very, very important at this point in time. I assure you that we'll continue to be very reasonable. We'll continue to interface with your office with the whole idea of working together to achieve results. Let me also thank the Minister of Health, who has also tried to commend our health workers. These are very difficult times, and clearly I think I want to lend my voice to commend these frontline health workers that have been doing very wonderful work. We have continued to interface with them at different levels, and that's why we set up the Labour Civil Society Situation Room, where workers can actually phone in. Their unions can also phone in, and we can be able to intervene, especially at the state level, secondary health care and primary health care, especially in terms of provision of PPEs and other things. I think it's important we try to emphasize, as the Minister said, the issue of scaling up occupational health and safety, looking at the number of health workers that have been infected so far. I think there is no gainsay that the health worker first need to protect himself before offering service to others. So I quite appreciate also the gesture that government is coming up with to try to support these frontline health workers. So as part of our contribution, the National Union of Textile and Garment Workers, particularly the tailors in Abuja, who are under that union, came up with a very wonderful idea to say that in order to support this fight, they needed to also think out of the box. They needed to use their skill and intellect to produce these locally made face masks. And they have so produced a large number. Our intention is actually to distribute free to other category of frontline workers. In fact, if you pass around the cities of Abuja, their work is not so much recognized, but they contribute a lot. As early as 5 o'clock, I see people sweeping the streets. And these are people that don't wear masks. In most cases, trashes are thrown on the street, contaminated. They pick them and keep our environment health. So first and foremost, we are going to distribute to them free, and also other category of paramedical staff that are also working, enforcing some of those decisions, but at the end of the day, they are not able to actually access this facility. So this is our modest contribution. I want to use this occasion to invite the chairman of the Tailors Union in Abuja. I think it can be replicated across the country because I think all your colleagues under the auspices of National Union and Garment and Tailoring Workers can also do this same initiative. Because the advantage of this locally made face mask is the fact that it can be washed. You can also iron it and reuse it. And therefore, if going forward, to make sure that everybody is protected, because the idea now is that since the disease doesn't have treatment, the best option is for all of us to be protected. And therefore, we need to scale the message down to the nooks and crannies of our country. And I think this ongoing effort needs to be commended, but I think this is why we are here, sir. So let me invite him to bring samples, and I will invite our chairperson, and as well as the Minister of State for Labor. And let me say that the whole initiative was taken yesterday when we interfaced with the SGF and the Minister of Labor. And within a very short time, we are given this opportunity actually to do this ceremony today. So once again, sir, I want to thank you immensely. And I think he has said clearly that anybody that has idea, it's not time to actually shut anybody out. Anybody that has idea on how to contribute, those people can come forward. So come, Chairman. Then, okay. Then Secretary of NLC and Comrade Joel, you can observe social distance and join me as we do this formal we hope tomorrow morning will start this. Sorry, sir. There was a question about whether the contributory pension can be used as palliative. Well, the contributory pension is actually not a free money. It's money that belongs to the pensioner. It is in the pensioner's retirement savings account. It is structured in such a way that he will continue to draw this money throughout his life. So clearly speaking, we need to protect those funds, and we need to also make sure that the pensioners or the workers that are contributing this money, at the end of the day, if they are not working, they should be able to have something to rely on. So clearly, I think it should not be used for this purpose. Thank you.
Thank you. Finally, we invite the SGF to the podium.
Thank you. Let me start by truly thanking the President of the Nigerian Labour Congress, who is also the President of the International Union of Workers. So he, like I said yesterday, not knowing that this occasion will happen today, that he is listening to his workers all over the world, not only the Nigerian Labour Congress. He acts in dual capacity. And when he comes to give an advice, it's based on an informed platform of the experiences of workers in different climes and in different jurisdictions. So your advice, your recommendations will not be taken lightly, because you're talking as a representative of the workers in over 100 countries of the membership of the union which you lead. So it's not an advice that can be treated with levity. We respect your opinions, and we want to thank you for this very good gesture of providing masks. And the kind of people that you intend to give out this mask for are people that really need it in these very, very trying times. And the fact that it's made out of our local fabrics, it's a thing that can be easily handled. Use it in the morning as you return home in the evening, you wash it, dry it, and iron it. And it's safe for you to continue to use it on a daily basis. So we want to thank you with by extension, the Garment Workers Union for this very, very generous and gratifying support that we have received from you today. And thank you for coming, and thank you for lending your voice to this national response. It's not a time for any joke. COVID-19 is here with us and is real. And as a nation and as a people, we need to arise and collectively give a response that will give some element of hope and respite to our people. So thank you with your team for coming. Let me answer the few questions that are here. The first one is somebody has complained that the Abuja Electricity Distribution Company is threatening to cut off their light supply. You wonder, and you'll be surprised that I've equally been threatened by them. What that presupposes is that It's not a business that is controlled by government. It's in the hands of private entrepreneurs now who bought over the discourse, and they are in pursuit of making their money. But you have a leeway. I know that the Nigerian Electricity Regulatory Commission has a consumers forum where you can lodge your complaint if you receive those kind of trades. Well, I didn't have the time to engage them up to the time of going to the Nigerian Electricity Regulatory Commission. I just asked what was the basic problem. It took a lot of time. They said that they looked at my meter, that it was not operating the way it should operate. I said, okay, can you provide me with a new meter if you think that this meter is not serving the purpose? I've had the meter for over 10 years. And a machine that is working for over 10 years, not being serviced, it's capable of developing some faults. Can you give me a meter, a new one? I paid for it. They disconnected that one, and we're applying a principle of the term in terms of payment. They just gave me estimates to be paying, and I had to wait for a new meter for about 3 to 4 months before they brought the new meter and installed it. I'm giving this example to tell you that even the secretary to the government and the chairman of the Presidential Task Force is not exempted from their threat. But what I'm saying too is that there is a forum that has been created, a consumer forum by the Nigerian Electricity Regulatory Commission, where you can lodge your complaints and receive appropriate action from the Regulatory Commission. Pension funds, I'm very grateful. I must thank you for the response. But at TVC, we had looked at issue of pension funds. As a matter of fact, we even got the Minister of State Education to do a position paper. And our conclusion was that the time is not even ripe for us to go there. Because the entire world order, in terms of our economy, in terms of our health system, has been disrupted by COVID-19. And the consequences, nobody can imagine until probably the dust is settled. I'm being honest with you. The consequences all over the world. When I hear people talk about scarcity of reagents, testing equipment, PPEs, I say we have to reflect on these things. These are commodities that all countries of the world are in pursuit of. At the same time, everybody is looking for those materials. The sources themselves where they are produced are also looking for the same material. And because of the interruption in the production processes, everything has slowed down. So there is unimaginable scarcity. Yesterday I saw on Sky and CNN a plane load of PPEs arriving from Turkey into England. They have been waiting and they have been talking about that. We are waiting for PPEs. I say, Great Britain waiting for PPE from Turkey. That is the magnitude of what is confronting the world. The entire world economic order has come to a standstill and is being distorted and disrupted by COVID-19. So we will continue to push as a country and as a people. But I can assure you that God being on our side, this same thing would come to pass. Somebody asked about the issue of the 500 billion and whether the 48 million that was given by the Chinese yesterday is part of it. No, it's not part of it. The 48 million that was given yesterday and so many other contributions that are coming in, they go into a separate account that has been created by the Office of the Accountant General in about 5 banks, I think 5 commercial banks. On a daily basis, the Accountant General will move that amount of money and take it to the 2 central bank accounts that have been created for COVID-19. The 500 billion is a product of the Economic Committee that was going to look at the impact of COVID-19 on the economy and propose some economic interventions in different areas. And that committee is headed by the Honorable Minister of Finance, Budget and National Planning. They were set up with the task force at about the same time. They've got their own responsibilities. They've even engaged with the leadership of the National Assembly to see what budgetary and what legislative framework can be put around the expenditure of 500 billion. We don't have control over that. That is an entirely different thing. Part of it will be used for COVID-19 expenditure. Part will be used to support manufacturing and all those things. So it's an entire package that the committee was given the responsibility at looking at. So the 500 billion is not for COVID-19 presidential task force to expend. The 48 million that was given by the Chinese and some other donations are going to be pooled into an account that is controlled and regulated by the Office of the Accountant General. The last question I want to take is this one about synergy between the federal government and the states. As a matter of fact, if there's anything that has consumed us in the last couple of weeks, it's building this energy and momentum. Because we realize that at the federal level, whatever level of success we achieve, if it is not translated to the states, the entire national response would collapse. Because the people live in the states, though Abuja and Lagos are the epicenters now, but we have seen seeding of the virus in different states. So we have encouraged the states to build capacity by provision of isolation centers. You remember one of the press briefings here, I spoke quite clearly that each state should provide at least a 300-bed isolation center. Because if you don't have a case now, thank God for it, but prepare for the worst. So we are working in a collaborative manner. Let me give you an example. We had to get the DG and the representative of the WHO to tour 9 states in 3-4 days, all in an attempt at building synergy. They met all the 9 governors. They had discussions with them, with the task force that have been set at the state level. They are replicating what we have at the national level. But in addition to that, they have their EOCs, emergency operating centers, where the experts congregate on a daily basis to review their strategies in their state. And the DG, Center for Disease Control, is online with them on a daily basis to know what is happening in all the 36 states plus the Federal Capital Territory. So we are working in concert. The national coordinator has held meetings with the commissioners of health of the various states online. The Honorable Minister of Health has just concluded a National Council of Health, I think this week, with all the commissioners in attendance via video conferencing. So we are doing everything to ensure that the states and the federal government have one national response. But at the subnational level, there are differences. What Kano is dealing with now is not what Adamawa is dealing with. It's not what Lagos is dealing with. So we understand these differences and the mode of operation might differ, but the content and the response is one. And the basic protocol that we have issued is what is guiding their operations in the various states. So I believe that we've built momentum and we are working as one team, because this particular pandemic is going to ravage our people and ravage our wealth if we do not put up one national response. And there's no we should not allow for a weak link in this particular enterprise. We must all work together to ensure that we succeed. Thank you.
Thank you, SGF. That brings us effectively to the end of today's national briefing. I must thank the NLC for the donation of the masks. Thank the media partners who have been broadcasting live and our colleagues who have persevered. NAPTIP and Site Savers for the sign language support, and all our viewers that have listened and watched attentively to what has been presented this evening. Two messages are out of this briefing. One is help stop the spread, reduce all non-essential travels. The victory we crave requires collective effort. Take responsibility, give hope to life. The second one is a reminder to parents. The Minister of State Education did that succinctly. Parents, please check the teaching timetable and the platforms for your children to continue to learn while at home. Check the website of the Federal Ministry of Education. Please, 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 they are not on holidays, and the future of this country rests in the development of our children. I thank you very much. God bless Nigeria. See you on Monday, God willing.
Hello and thank you for joining us on NTA Nationwide. I'm Naja'atu Tijani. 108 new cases of COVID-19 have been reported. 78 are in Lagos, 14 in the FCT, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, 1 in Kwara, and 1 in Plateau State. As at 11:30 p.m. 23rd April 2020, there are 981 confirmed cases of COVID-19 reported in Nigeria. 197 have been discharged and 31 deaths recorded so far. And now let's join Mitaire Ikpen live from the SGF's office for highlights of the Presidential Task Force on COVID-19. Mitaire, what's the latest?
Good afternoon, Najatu. The Presidential Task Force this evening said it has secured life insurance cover for about 5,000 workers who are in the front line in the fight against COVID-19. This is coming as a motivation, especially against the backdrop of the reports by the Minister of Health yesterday that more than 40 health workers has tested positive for the coronavirus. So this incentive of life insurance cover, no doubt, is expected to encourage the health workers. Again, the Presidential Task Force today emphasized the need for farmers to prepare for the next planting season. The Presidential Task Force says this is necessary because food security and self-sufficiency cannot be compromised as the nation battles the coronavirus. Again, the Presidential Task Force says wearing of the face mask is mandatory, but is only one of all precautionary measures which the country has to take in the fight against the coronavirus pandemic. And good enough, today the National Union of Textile and Garment Workers presented locally produced face masks to the Presidential Task Force for onward distribution to frontline workers who are involved in the fight against the coronavirus. The Presidential Task Force today again reiterated its appeal to Muslims who have commenced the Ramadan fast to observe all the advisories, especially that of social distancing and observance of personal hygiene as part of effort to curb community transmission of the coronavirus during the Ramadan season. And of course, it felicitates with all Muslims at this time and is hopeful that all prayers offered to the Almighty during this season will be answered. Those are some of the highlights. Najat.
Shmitari, thank you very much. Well, thank you for those updates. And following the sighting of the Ramadan crescent, President Muhammadu Buhari sends his best wishes to Muslims in the country and all over the world as they begin this year's month-long fasting. A statement from the Senior Special Assistant to the President on Media and Publicity, Garba Shehu, quotes the President as congratulating all Muslims as they commence this year's Ramadan fast, which is depicted by self-denial, universal brotherhood, austerity, and helping relatives and the needy. President Buhari describes Ramadan 2020 as a challenge as it is coming at a period of the global pandemic which has spread to virtually all countries, and advises citizens to avoid large gatherings and have their prayers and feasts individually or with family at home. President Buhari urges Muslims to endure and not use the coronavirus as an excuse to abstain from the Ramadan fast unless such abstinence is warranted by the excuses clearly outlined by health and religious authorities. Meanwhile, Muslim faithful have been enjoined to use the holy month of Ramadan to seek God's divine intervention in the ravaging coronavirus pandemic. Doni Dia has a compilation of messages from some notable Nigerians.
Allahu Akbar, Allahu Akbar. Ramadan, the ninth month of the Islamic calendar, is observed by Muslim faithful with fasting as one of the 5 pillars of Islam. For the Senate President Ahmed Lawan, this year's Ramadan came at a most unusual time when mankind is contending with an existential threat in the form of the deadly COVID-19 that has shut down the economy and entire social life throughout the world. While urging Muslims to abide by the stipulated guidelines, the Senate President assured them of the government intervention to their plight. The Speaker, House of Representatives Femi Gbajabiamila, has also congratulated Muslims on the peaceful entry into the month of Ramadan, describing the period as a time of sober reflection and a time to get closer to the Supreme Creator. The Speaker encouraged them to be their brother's keeper, including non-Muslims among them, adding that Muslims should pray for peace, progress and unity of the country, as well as an end to the coronavirus pandemic. Similarly, the chairman North Central Governors Forum and Niger State Governor Abubakar Sani Bello encouraged Muslims to pray for peace and end to the coronavirus pandemic. Governor Sani Bello reminded them on the need to show empathy, piety, alms given to the less privileged and most vulnerable without discrimination. The All Progressives Congress APC has also felicitated with Muslim Ummah on the sighting of the moon and commencement of the Ramadan fast. The APC says while government continue to scale up on the palliatives to support the various segments of the society, it is important for the people to pull themselves along during this period. In the same vein, the People's Democratic Party, PDP, has urged Nigerians to use the period of Ramadan to pray fervently for the nation, as well as instill acts of self-restraint as commanded by the teachings of the Holy Prophet Muhammad, peace be upon him. In Abuja, Duni Dia, NTA News.
Thank you, Doing. Now we have Khadijat Akombi live in Lagos for a situation report on the first day of Ramadan. Khadijat, Ramadan Kareem.
Same to you, Najatu. This is Lagos Central Mosque. And following the sighting of the moon, which was announced yesterday by His Eminence, the Sultan of Sokoto, Muslim faithful in Lagos joined their counterparts across the world and indeed Nigeria to commence the Ramadan fast. Usually, the month of Ramadan, there is a high level of spiritual consciousness, the Ramadan lectures, the tafsirs, congregational prayers, but the situation is different this time around because of the COVID-19 pandemic. The Lagos Central Mosque here has been under lock and key for about 4 weeks now, and all the Jumat mosques in the state have not been operating for the past 1 month. Recently, the Governor of Lagos State, His Excellency Mr. Babajide Sanwo-Olu, appealed to the Muslim faithful to cooperate with the government in the fight against the COVID-19 pandemic, and the leadership of the Muslim community has also been meeting with the Islamic scholars and the Imam to regulate the conduct of the faithful during this period. I'm being joined by the Chief Imam of Lagos, Sheikh Suleiman Abu Nola, who's going to tell us more about the measures taken to sensitize Islamic scholars and the Imam on how they should comport themselves during these holy months of Ramadan. Assalamu alaikum. Sir, can you tell us what measures have you taken to regulate the conduct of the Imams and Islamic scholars during this period?
Well, first of all, we need to thank Almighty Allah for having and being alive to witness the commencement of Ramadan. Secondly, we need to acknowledge and appreciate the efforts of the Lagos State government under the leadership of Governor Babajide Sanwo-Olu and all the frontline workers that have been helping us to contain and curtail the spread of coronavirus in Lagos State. Mostly, what we are doing, we are collaborating with the Lagos State government, all the religious leaders in the state, in helping us to take a precautionary measures against this pandemic. What we've taken so far is that the Lagos State government has asked all religious leaders in the state, after having a fruitful deliberation and a consultation with all religious leaders, that all religious activities for now should be suspended. So before the commencement of Ramadan, we've suspended Jumat. We've asked all the mosques in the state to close down for now. The only thing we ask them to do is that they can call to prayer. But any gathering, any religious gathering for now has been suspended. We'll equally ask them to sensitize the Muslims, all the worshippers in Lagos, about improving on their personal hygiene, hand washing, using of sanitizers, social distancing. So this has been emphasized on more. And every day we've asked the Imam in their sermons to talk about the significance of the month of Ramadan, more so on the spread of the coronavirus and the impact too on the people. We pray Almighty Allah to assist us.
Yeah, thank you, sir. So the federal government and the state government have been rolling out palliatives to assist to cushion the effect of the lockdown. So, during a press conference organized by your office about 2 days ago, you talked about the need for the well-to-do in Nigeria to assist the less privileged, particularly at this point in time. Could you expatiate more?
Well, alhamdulillah, well, we all know the importance of Ramadan and the significance of Ramadan, most especially according to the details of the Prophet, that he said that Afdalu Sadaqah to fill Ramadan. Now, the rewarding charity that we do is mostly in Ramadan. So we appeal to our people, because if you look at Lagos, you are looking at like 20 million people. So the government has been doing its bit, but we need to complement their effort by assisting the poor, the needy.
Yeah, thank you, sir. That's about it from Lagos. It's back to you, Najatu.
Ramadan Kareem. Khadija, thank you for that update on the mood in Lagos as well as the measures being taken to curb the coronavirus pandemic. Meanwhile, as Muslims around the world commence the annual Ramadan fast, which is one of the pillars of Islam, guests on Good Morning Nigeria have advised them to desist from gatherings capable of spreading the coronavirus. Murjanat Adam Saeed reports.
With the sighting of the new crescent for the holy month of Ramadan, Muslims around the globe believe it is time for spiritual rejuvenation. Guests on Good Morning Nigeria say this time around it is going to be Ramadan with a difference, in line with the global reality of the coronavirus pandemic and lockdown.
All this in which we are facing, it is for us to actually start to go back to the pristine Islam, the way we actually used to do Islam. Like what Sheikh said, most of us have failed as leaders, as a family member, with thinking that we are too busy out there, we are doing that out there, and we have abandoned our family.
Many people think that we have connived with the government to prevent them from enjoying the rights of religion. And as such, it is very difficult, and it is a very tedious task to bring them back to their normal senses and understand that this is a pandemic fighting the entire world.
It is very, very essential to educate people. Once they told you that you are hearing deaths and COVID-19, this one died today, this one died in a particular state, and that one is enough for every one of us to take a look into this pandemic, that it is real.
The guests also advise on the need for all to do the right thing and adopt the guidelines, which are only temporary.
It's a trying time, and we must really do as the medical advice really mandates, and it is simple.
They, however, say alternative use of live streaming must be engaged, urging the have to assist the have-not, as the traditional way of sharing food violates the containment protocol of the federal government. In Abuja, Morijanatu Adam Said, NTA News.
It's time for a break now. When we return, we'll have a guest in studio who will speak about observing Ramadan with COVID-19 challenges. Stay tuned.
Today, the cessation of movement, physical distancing measures, and the prohibition of mass gatherings remain the most efficient and effective way of reducing the transmission of the virus. By sustaining these measures, combined with extensive testing and contact tracing, we can take control and limit the spread of the disease.
كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون.
The glorious month of Ramadan is here again, and we at Al-Habibiyah Islamic Society once again call on all faithful to observe the physical and social distancing directive of the government to curb the spread of COVID-19. Always wash your hands with soap and water, use hand sanitizers and face masks when necessary, and stay at home. Observe your obligatory salat, tarawih, tahajjud, du'as, and askars with your families from the comfort of your home. Stay at home, stay safe, stop the spread of COVID-19. This message is from Al-Habibiyah Islamic Society, from Allah to you, a light.
Alpha, say tomorrow still day on.
What's your tomorrow?
Community meeting now.
You know they hear Abi?
Na beggy. See, if we meet for my house, inside parlor, then go no.
This COVID-19 is not a child's play.
If we want to elect a new secretary, we fit to
do one for WhatsApp, or for Skype, or even on Zoom. Or we just wait.
I will not negotiate
this social distancing. It is non-negotiable.
Not every infected person shows symptoms, but every infected person is contagious. Avoid large gatherings and self-isolate if you think you might have come in contact with a carrier. Your safety and the safety of others is in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
I just don't understand this coronavirus thing. Is it real?
See, coronavirus, known as COVID-19,
It's a global problem and has killed thousands of people in China, Italy, Spain, UK, US, and other countries around the world.
Okay. Now, why are they saying that we should stay home?
Because if you go outside and get in contact with someone who is infected, you become infected and then come back home, affect your family. That's how it happens in other countries.
Now, please, help me explain what this social distance is all about.
See, as we are now, the virus travels through the air and by touch. We must maintain 6 foot distance at all times.
Oh, so it's not by washing my hands with soap and water or hand sanitizer that is only important?
Washing of our hands regularly is very important. But we must come together and fight this virus like we did Ebola. It is our responsibility to each other.
This is the Ramadan edition of NTA Nationwide. Now, prior to the sighting of the moon, the Sultan of Sokoto, Muhammad Sa'ad Abubakar III, urged Muslim faithful to stay at home and pray for the end of the coronavirus pandemic. Sultan Abubakar noted that Islam's position on plagues and pandemics is clear and that most forms of worship like night vigils and Taraweeh can be done at home. Now, the Chief Imam of Area 10 Jummat Mosque, Garki Abuja, Imam Yahya Garba Al-Yolawi, is here to shed more light on this. You're welcome to our studio.
Thank you very much.
And Ramadan Kareem.
Thank you. Ramadan Mubarak.
Thank you. Now, what is the best way to practice safe a fast during this month of Ramadan in view of the coronavirus pandemic?
Yes, as it is, Alhamdulillah, for the first time, first of all, we must thank Allah subhanahu wa ta'ala for witnessing this kind of periods of blessings and a period where we are expecting our prayers to be answered. And yes, we must observe all the social distance, all the efforts as we can do, but we must put in our mind that we need divine intervention. This divine intervention, why? Because it is beyond our imagination. It's Allah subhanahu wa ta'ala that created the whole thing. Maybe it is out of our sins, out of our activities, that He is trying to draw our attention to come back to our senses in order to be a very good servant of Allah. So now, coming back to your question, how can we have a safe Ramadan fast? Yes, we must observe all the rules, all the injunctions given by the medical practitioners. Because Allah says, "Fas'alu ahla zikr." They are the one who knows it better than we do, and they have given some prescriptions. As we follow that, and we add with prayers, underline it, prayers, because we need it. If God forbid we witness something, things that we are seeing there, and it comes to Nigeria, what do you think? And look at how Allah subhanahu wa ta'ala is controlling things for us. Up to now, we are not counting more than 1,000. It's just today I saw 980 something. So with the prayers and devotion and stopping all what we are doing, then it will what? It will save a lot for us.
So in that regard, what are religious leaders doing to create more awareness and to ensure that faithful comply with the directives?
You can see a lot of us, a lot of clergymen, scholars are online now. They are up and doing, sending things via YouTube, via Facebook, via all these channels, including, I can see even Zoom now. There is some Zoom meeting that is going on. All the tafsirs now are online. Virtually almost all the activities now are online. And we have been encouraging our people to stay at home, and even the spouses, they should learn how to do their Taraweeh at home, let them know that Allah subhanahu wa ta'ala is always helping who is helping himself. If you help yourself, then he is there to assist you. Inna Allah la yughayyiru ma biqawmin hatta yughayyiru ma bi anfusihim. Allah subhanahu wa ta'ala will not change a situation for a human being, for a man, until or people, until they have changed by themselves. How can we change by ourselves? To what? To put everything in place in order to prevent ourselves from this.
Thank you very much. Thank you very much. That was the Chief Imam of Area 10, Juma Mosque, Imam Yahya Garba Yulawi. Now, in furtherance, Vice President Yemi Osinbajo has met with a group of ministers who were directed by the President to jointly develop a comprehensive policy for a Nigerian economy functioning with COVID-19. President Muhammadu Buhari had asked that the Economic Sustainability Committee support the said ministers in executing the directive. The Vice President proceeded with the Ministers of Industry, Trade and Investment, Science and Technology, Transportation, Aviation, Interior, Health, Works and Housing, Labor and Employment, and Education on the work of coordinating the efforts in order to produce a comprehensive economic sustainability plan that will turn the current economic challenges into opportunities for the Nigerian people as envisioned by the President. The Senior Special Assistant to the President on Media and Publicity, Office of the Vice President, Laolu Akonde, says by next week, the Economic Sustainability Committee would also be meeting with the Presidential Economic Advisory Council ahead of the completion and submission of its report to the President. And now let's join Hingino in Lagos for more updates. Hello, Hingino.
Hello, Najaatu. 7 ventilators will be activated by this weekend to cater for serious cases of COVID-19 in Lagos State. The Commissioner for Health, Professor Akin Abayomi, while briefing members of the Lagos State House of Assembly on government's effort at containing the spread of the virus, again called attention to the adherence to social distancing order. Nosa Osula reports.
Saddled with the responsibility of ascertaining the level of progress made by the executive in combating the COVID-19 pandemic in Lagos State, had earlier showed legislative support for the government's efforts as well as empathy for residents on the statewide lockdown during their visit to the isolation centers on Tuesday, 21st day of April. During the interactive session, lawmakers expressed concern over the increase in community transmission of COVID-19 in the state and residents' disregard for social distancing, as well as other measures put in place by governments to curb the spread of COVID-19.
Leadership is about taking charge. Leadership is about showing the way. And that is what we should be doing.
There needs to be an involvement of the local government. We have a very high percentage of senior citizens. It is a very serious situation, and I am worried.
The State's Commissioner for Health, Professor Akin Abayomi, made it clear that government's priority is to flatten the curve of the virus in the state by curtailing community transmission of the disease.
You do not see these events often, but when you do see them, they will overwhelm even the most sophisticated and well-developed economies.
Professor Abayomi also called for more investments in research and development to prevent the development or reoccurrence of diseases such as COVID-19 in Lagos. Nosa Osula, NTA News.
That's it from Lagos. It's back to you, Najaatu.
Thank you, Hingino. Now, the United States government has described the late Chief of Staff to the President, Abba Kyari, as a dedicated public servant and respected interlocutor for the American government. In a condolence message to President Muhammadu Buhari, the Assistant Secretary of State for African Affairs, Tibor Nagi, eulogized the important role played by Kyari in the repatriation of more than $300 million looted by former head of state Sani Abacha. The U.S. Assistant Secretary noted that this vision, encapsulated by the late Chief of Staff, was a reflection of his tireless championing of a solid and prosperous future for Nigeria. While commiserating with the government and people of Nigeria and the Kyari family on the loss, the U.S. government pledged to stand with Nigeria in the struggle against the coronavirus pandemic. The president also received condolence messages from former Minister of the Niger Delta, Usani Uguru Usani, and Kano-based businessman Alhaji Sabi Ubako, and trade union leader Baturi Abdulaziz. Now, COVID-19 has been a challenge for many, compounded in part by the high mortality of malaria, which is said to kill faster than HIV/AIDS. And though World Malaria Day is tomorrow, its impact makes it a continuous subject. With me in the studio is Dr. Adironke Akonde, a consultant public health physician, to tell us more. You're welcome, Doctor.
Thank you for having me.
Now, are there reasons for people with malaria to fear the coronavirus?
Yes, I must say there is a lot of reasons for people with malaria to fear COVID-19, in the sense that malaria has been ravaging this country. Every year we record over 100 million cases, and we have over 1,000 cases of deaths. A majority of these are children under the age of 5 years. So there is a great need to be worried, because a lot of attentions are being driven to COVID-19 rather than to also carry along the underlying endemic diseases in Nigeria.
Now, let's talk about the doctors. 40 doctors found to be positive with COVID-19. What went wrong?
Well, I must say it is very sad to learn that over 40 health workers are now battling with COVID-19. Why do I say so? Because Nigeria currently, the health system is very weak, and we have over less than 75,000 doctors as a whole. So if we are now having about 40 coming down with coronavirus, so it's going to worsen the already weak health system in Nigeria. So there's a cause to be worried, and a lot of things are responsible for this. Perhaps the health workers are not adequately equipped with protective equipment. And so many cases of COVID-19, they refuse to present themselves to the authority in charge of managing the pandemic. They tend to be secretive about it. They move from one hospital to another, endangering the life of people, the life of doctors, the life of health workers, and the life of the community in which they live. So this is responsible in a way. And in another sense, we health workers, we need to take the issue of safety with our hands. We need to take it serious. This is the time for you not to see any patient without PPE. You need to request for protective equipment before you attend to a patient, and we need to reason along, because there is a lot of cases that will present and they will not show the specific symptoms of COVID-19. So
you're talking about safety being on both sides, both on the part of the doctors and those coming to the hospital.
Yes.
Thank you very much, Doctor.
Thank you.
And now we'll head to Just for more reports as Plateau State records the first case of coronavirus. Caleb is standing by.
Thank you very much, Najatu. Welcome to JOS. The Plateau State Commissioner for Health, Dr. Nimkom Lardam, says the state surveillance team has commenced contact tracing of the index case while strengthening other public health measures to curb the spread. Ashezi Gopep reports.
The COVID-19 test was conducted on the index case, who came into Jos from Kano on 17th April 2020 and has been quarantined since arrival. The commissioner said on investigation of the suspected case, who exhibited symptoms, the lab results from NVRI VOM released on Thursday 23rd April returned positive.
We have a confirmed case of COVID-19 in Plateau State, an index case. Well and picked her, took her to our isolation center, quarantine center. She stayed there for 2 or 3 days, and then she started showing some symptoms. And we took her samples for tests, sent it to NVRI, and the result came out positive. We will do our best to be sure that this will not escalate. We are doing contact tracing, and we are on top of the issue.
Meanwhile, the Commissioner for Health said the patient is in isolation and the condition is stable. He further advised the public not to panic, but to continue to imbibe good personal hygiene, social distancing, and to avoid crowded places, as well as stay at home. In Jos, Ashes Gopep, NTA News.
Najatu Ramadan Karim from Jos.
Thank you, Caleb. Now, as part of efforts to prevent the spread of COVID-19, the Bayelsa state government has commenced the demolition of illegal structures in major markets within Yenagoa, the state capital. Emeka Okpala reports.
This was the complaint presented by traders who also claimed that they are not given adequate notice before the demolition.
If government want to push us out of this place, they have to arrange that place for us to go. And the place they say we should go, if you go to that place, it's a forest.
They are demolishing somebody's property. You have to give him at least 7 days. At least 7 days.
But the leader of the task force and chairman implementation committee on COVID-19 in the state, Dr. Inodu Akpoku, said the exercise is to ensure full implementation of the social distancing order by the state government. You can now see, we are seeing a bright hair from here. Before, you cannot even recognize where you are. Another member of the team and technical assistant to the governor, Dr. Bomas Perejak, said government had severally directed the affected traders to relocate to the new stores, especially during this pandemic, but to no avail.
We are very stubborn. That is the outcome of it. All of us, we are aware. The date that was even given to us, another extra time was even given to us for the vacation.
The Permanent Secretary, Ministry of Information and Orientation, Mr. Fristin Akbo, who conducted newsmen round the over 600 new market stores, assured the traders that government meant well for them.
This will enhance the social distancing, because if you go to the market and you want to buy pepper and tomato, you know exactly where you have to go to. You want to buy meat, you know exactly where you have to go to avoid this shoulder rubbing and then also enhance social distancing.
Emeka Okpala, NTA News.
With the inauguration of a joint technical team on emergency response to COVID-19 by the Minister of Agriculture and Rural Development, Mohammed Sabo Nanunu, the federal government is taking what it describes as a decisive action against transport operators who hide under free movement of agricultural produce to carry passengers. Musa Baba Aliu reports.
Almost all states of the Federation are under lockdown as part of efforts to curb the spread of COVID-19. Only agricultural produce, petroleum products, and pharmaceutical consumables are allowed to be moved from one location to another by any means of transportation. However, it has been observed that motorists, especially truck drivers, are taking advantage of that to transport people, thereby increasing community transmission of coronavirus. It is based on this that the Interministerial Committee on Food Security set up a task force to be headed by the AIG operations to check abuses associated with the movement of agricultural produce and inputs across the country.
But one thing we will not tolerate, and this is something very important that transport union should note, that any movements of goods, agricultural input, should not be accompanied by passengers. This is a very clear instruction that we have to give to all the transporters.
task force has also been directed to allow farmers access to their farms and move freely with inputs such as seeds and fertilizer.
It's a very, very important national assignment. Remember that you are assisting the ministers to implement the directive of Mr. President. So committee is up to this job because it is important to the survival of our nation.
Members of the task force consist of officers of the Nigerian Army, Nigeria Security and Civil Defense Corps, All Farmers Association, as well as officials of the Federal Ministry of Agriculture. In Abuja, Musa Baba Aliyu, NTA News.
Dibabari in Port Harcourt is next on Nationwide.
Najahatu. River State government has released 62 inmates at the State Correctional Center as measures to decongest the prisons in this era of COVID-19. The State Chief Judge, Justice Adama Iyai Lamikra, said action is in response to the directive from the federal government. Jenny Bassi reports.
President Muhammadu Buhari had earlier this month granted pardon to some inmates of the custodial centers of the Nigerian Correctional Service. In compliance with this directive, Rivers State government released 62 inmates with a charge to them to comply with the sit-at-home order of the state government until it's lifted. Chief Judge of the state, Justice Iyai Lamikra Adama, said those convicted for serious crimes like kidnapping, murder, and armed robbery were not included.
As we go from today, don't go back to committing crime.
Comptroller, Correctional Service, River State Command, Timothy Tinuoye, thanked the federal and state governments for the release, noting that it is a great relief to the center in this critical moment that COVID-19 is posing a threat to human existence.
For this social distancing, the prison is congested, most of you know, and we have made our move so that some of the inmates can be released. And so today that the Chief Judge has carried out that function, we are indeed happy that there will be more space in some of the cells.
The 62 inmates were given stipends for transportation to their various destinations. In Port Harcourt, Jenny Bassi, NTA News.
And that does it from Port Harcourt. Nationwide, we continue right after the break. Good evening.
In this time of despair, our country, Nigeria, needs us now more than ever. We stand a chance to save our great country, Nigeria. A chance to rise up from this pandemic stronger and better. What will be the gain if we do not learn from other countries and observe the lockdown to stop the further spread of the virus? If we loosen our guards and allow this virus doom our very existence, then what have we gained? This is the call to every Nigerian to unite as one and stop the spread of this deadly virus. Stay at home and stay safe. Remember, the virus doesn't move unless we move. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
As you can see, I'm at home. I'm reading a book. When I get bored, I watch movies. Life has not stopped. Together we can beat this thing. All we have to do is make sure we do the necessary things, which is wash our hands, use hand sanitizer frequently, wash your hands with soap. Please avoid crowded environments, crowded places. If you must head out maybe to get groceries, use the face mask. So please stay safe, stay responsible, and stay at home.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 22 55 4272. This message is brought to you by ICPC and NTA.
Over the past few seasons, Airtel Touching Lives has helped to empower and uplift thousands of Nigerians, and this season was no different.
People are really suffering.
I still have a hope.
I know that God doesn't leave things halfway.
Thank you to all our viewers for inviting us into your homes and sharing in our journey as we continue to change lives.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks for staying with NTA Nationwide. Amidst the COVID-19 lockdown and Ramadan fast, hundreds of indigent and vulnerable people in Yobe State are set to benefit from assorted food items donated by the Northeast Development Commission as part of its multinational, multidimensional humanitarian intervention to cushion the hardship faced by targeted beneficiaries across the Northeast. Yunusa Suleiman reports.
The donation of the food items, according to the Northeast Development Commission, is part of a much bigger humanitarian intervention planned to be unveiled soon, meant to ameliorate the sufferings of the targeted beneficiaries distressed by the insurgency and COVID-19 lockdown.
Committee has been set up in the local government areas, down to the wards and to the following units. So this item will equally follow the same channel, and the method used was that the stakeholders in the local government are responsible for ensuring distribution at the local government level to the wards and to the units.
2 brand new ambulances and 50 hospital beds were also donated by the Commission for Yobe State Government to strengthen its preparedness, prevention and control efforts against COVID-19 and other emergencies.
One of the principal mandates of the Commission is to assist the IDPs and the vulnerable. Initially, we are to deal with the issue of Boko Haram and IDPs. The COVID-19 has also ravaged this nation, and then we feel that people have lost a lot of time and money. So the little assistance will come from the NDC will be of help.
The donation of the food items came few weeks after the Commission handed over some medical equipment to the Yobe State COVID-19 Committee on Prevention and Control to fight the outbreak of coronavirus in the state. In Damaturu, Yunusa Suleiman, NTA News.
Let's now join Mohammed in Maiduguri for more on Nationwide. Ramadan Kareem, Mohammed.
Ramadan Mubarak Najatu, thank you and welcome to Maiduguri. The state so far has 12 confirmed cases of coronavirus, out of which 2 died, including a case from Gombe who later died at an isolation center in Maiduguri. The State High-Powered Response Team for the Prevention and Control of COVID-19 has therefore reiterated commitment to tracing all contact persons during the lockdown period to slow down and contain community spread of the virus. Pauline Kujavana has an update on Day 3 media briefing by the response team.
The daily situation briefing is meant to keep the public abreast of development regarding COVID-19 with the lockdown in place. Commissioner of Health Dr. Salisu Kwaiburu said out of the confirmed cases in Borno, 7 receiving treatment at the isolation center are in stable condition and with close monitoring by the health workers despite the death of the Gombe confirmed patient at the center. According to him, 11 samples from the Pulka Index case manifested no symptoms, with the response team receiving 5 alerts to be evaluated and reported soon.
I would like to appreciate the effort that each and everyone
we will soon overcome these challenges and be able to move forward.
The committee expressed satisfaction with the level of compliance with the lockdown and appealed to the citizens to see the order as measures to improve their well-being and pledged to employ certain strategies to cushion the hardship that might arise from this lockdown.
We pray and hope that we do not register any more victims. As the briefing goes on, any single thing that is discovered along the line will definitely be related to you.
We are deliberately giving both positive and negative cases. Borno is a crisis environment. Then in crisis communication, there is what is called plus-minus approach.
Contact tracing, isolation, and quarantine of suspected cases are being vigorously pursued by the high-powered response team, both within and outside Maiduguri, the state capital, to contain community spread. In Maiduguri, Pauline Kujevana, NTA News.
That is all from Maiduguri. Nationwide continues in Abuja with Najatu. Happy Iftar.
Thank you, Mohammed. I wish you a happy Iftar too. Now, commercial motorcycle riders, popularly known as Okada in Kwara State, will start to receive a loan of 5,000 naira each next week. Kwara State Governor Abdurrahman Abdurazak says the money is to ease their financial burden during this lockdown period. Raliat Ibrahim reports.
100 million naira will be disbursed to 20,000 Okada riders in Kwara State. Governor Abdurrahman Abdurazak was at Government Secondary School Ilorin where the enumeration of beneficiaries was being done. He told the Okada riders the loan was part of the state government's social investment program.
We've seen the impact of COVID-19 on their businesses and the stay-at-home order. That's why we decided to enumerate them and give them aid for their businesses, because how do we expect them to survive sitting at home not working? So this also will be extended to other segments of the economy.
Kogi-born Andrew Aigboka is an Okada rider who resides in Ilorin, Kwara State. He has been having difficulty feeding his family since the start of the lockdown.
It's not easy for us, but with this one now, by the special grace of God, we are going to manage up.
The loan will be extended to all sectors of the economy to ensure businesses do not grind to a halt during the lockdown period and after. Raliat Ibrahim, NTA News.
The National Judicial Council, under the chairmanship of the Chief Justice of Nigeria, Justice Ibrahim Tanko Muhammad, has instituted a 10-man committee on court sittings. This was at its 91st meeting held online on 22nd and 23rd April. The committee, which has Honorable Justice Olabode Rhodes Viva as its chairman, is to present urgent but practical strategic measures to ensure courts continue to function despite the lockdown and COVID-19 challenges. Its terms of reference include guidelines for a template for implementation to explore possible areas of collaboration between the judiciary and the Office of the Attorney General of the Federation. The committee has 14 days to submit its report. The council also recommended the compulsory retirement of Honorable Justice Francis Chukwuma Abosi, Acting President, Customary Court of Appeal, Imo State, and Honorable Justice Aliu Musa Liman of Bauchi State High Court of Justice with immediate effect. And that's all on Nationwide for now. Thank you for watching. Remember to stay at home and wash your hands every 20 minutes.